Let's talk about MS phenotypes, which is basically trying to describe somebody's MS. You've probably heard about relapsing remitting MS, relapsing MS, primary progressive MS, or secondary progressive MS. Sometimes you'll see the term clinically isolated syndrome or even radiographically isolated syndrome. All of these terms are trying to describe how somebody's MS is behaving. And while they have been very important historically and can be helpful, we are somewhat trying to get away from these descriptions. Let's take a look at why. This slide is showing disease phenotypes per definitions from 1996 and 2013. Somebody might have progressive disease, which could be primary progressive, secondary progressive, or be progressive but still have relapses. Those criteria changed in 2013 and are now trying to state that somebody can have primary or secondary progressive disease with all these modifiers: active with progression, active but without progression, not active with progression, or not active without progression. Clearly, this is kind of a mouthful, confusing and complicated, and while it's trying to describe somebody's disease course, most of us feel at this point that it's kind of missing the point and making things a bit complicated. Multiple sclerosis is a complex disease that can have both inflammation and degeneration occur. They're typically both present at some different ratio, which can change over time. In what we call relapsing disease, somebody has much inflammation, typically at the onset of disease, and inflammation can cause things like contrast-enhancing lesions and relapses, or sudden symptoms. Degeneration is typically not as present at onset of disease, and that's what leads to just a slow worsening of function, which we call disability. So relapsing disease mostly has higher inflammation at onset, less degeneration, and often that will shift over time, that ratio. So relapses become less frequent because inflammation cools off. Progression of disability becomes more common because degenerative change starts to pick up. It's important to note that degeneration occurs with aging, but again is sped up in MS. So these are the two primary components of all MS that somebody might endure throughout their life living with MS. And the ratio is going to change over time. So really what we're trying to talk about, rather than all those complex terms and modifiers, is do we think somebody's having a high amount of inflammation at this point in time? Do we think somebody's having a high amount of degeneration at this time? And how might that impact our decision for treatments? If you look at this graph, it's a demonstration of what we're just talking about. You have the pre-symptomatic phase where patients might not even know that they have MS and they might not have symptoms. There are lesions which are occurring, and you can see them in the little green triangles. There eventually will be a clinical event, which we call clinical disease activity, or a relapse, and that will occur at some point, which would bring somebody probably to the doctor to say what's going on. They might be diagnosed with clinically isolated syndrome, relapsing multiple sclerosis, but at this point, they're under care and we are treating them. You'll also note the blue waving line is the inflammation, and you can see that picks up early in disease and tends to fade off, whereas the purple line starts to slowly pick up over time. We do think that a high frequency and severity of relapses at the onset of disease makes degeneration more likely to occur, which is one of the many reasons why it's important to control inflammation at the onset of disease as early as possible. There's been a large push to be able to diagnose people earlier on and then to treat earlier on, especially with highly effective therapies that do a better job of controlling inflammation. Another way to look at this, which I find extremely helpful and many patients do as well, is a model developed by a doctor named Stephen Krieger out of Mount Sinai in New York. He calls this MS Topography, or the swimming pool model of MS. There's a website, there's an app, highly recommend that you check it out, and you can play around with it and be interactive. But he's using a swimming pool to try to describe inflammation and degeneration as that changes over time in MS. There's a lot of detail that you can get from this app and experience, but one of the key features I would like to point out is the real estate, if you will. There's a shallow end and a deep end of the swimming pool, and the shallow end represents, as you can see at the bottom in red, the spinal cord and the optic nerves. We have a talk on MRIs where we say lesions in different locations are more or less likely to cause you symptoms. And so in this case, in the shallow end of the pool, if an inflammatory event occurs, one of the white peaks, it's much more likely to peek through the surface of the water where you are then aware of that symptom. In the deep end of the pool, however, which represents the large hemispheres of the cerebrum in the top of the brain, a lesion might occur on the MRI but never make it anywhere near the surface of that deep water, and you'll never experience that symptom. So this covers lots of different aspects of living with MS and monitoring and managing MS that I think are extremely helpful. Also, if the pool starts to leak slowly over time, that clinical threshold, the water level, will drop, and some of those old peaks that were previously hiding underwater will slowly become visible. In other words, you'll experience those symptoms. I highly recommend that you look at this if you're interested in learning more about inflammation, degeneration in MS, and how that might affect somebody's experience.